many of us would agree that you always want to have the best of teeth sets, or so to speak. You want to have your dental formula looking all good, all beautiful. You know, you're able to afford a smile every other time to at least add, you know, into your days. And so this morning, we just want to give you tips, not necessarily tips actually, you know, crucial pointers as to how best you can, you know, make sure that your teeth is looking good, or your teeth are looking good, or so to speak, and you know you're having the best of it, or the best of experience, especially when you are having your meals, you know, whether cold, whether hot, whether warm, because sometimes we always have difficulties, especially with the temperatures. And we'll be having this candid conversation as to the basic things that you need to understand as you keep taking care of your teeth. And joining me for this conversation this morning is Dr. PJ Muriuki, who's a dental surgeon at Riverside Dental Suite, and we'll be discussing demystifying dentistry. It's very important that we have these conversations. We do not want to delve deep into so much. We have a couple of questions from you. And so in that case, I will just allow Dr. to take us through some of these questions, to give us answers to these crucial questions that we received from you, because it is crucial that we get them, and not just get them from anybody, but you know, from a specialist. And so, Dr. good to have you this morning as we get to this, you know, crucial conversation and key things that have been pinpointed by the people who are watching, and they are eager to hear from you this morning. So one of the key things they discuss is, you know, the oral tumors, or they speak about oral tumors and cancer for that matter. Many would probably argue that they have no idea whether such would happen. So evidently, when someone asks about this, is because it's in existence. So would you take us through this and just how best one can avoid the same?
Good. Thank you very much for having me, and good morning to your viewers. Oral cancer is, or oral tumors is a very wide topic.
Yes.
But I'll try just to summarize, and you can broadly categorize oral cancer into two types. We have what we now call the oral tumors, okay? And then we have the cancer. Cancer, the right word for cancer is actually malignancy. So what causes cancer? Cancer is caused by proliferation of cells, abnormal proliferation of cells in any part of the body. So in this aspect, we are talking about the oral cavity, which includes your lips, your mouth, the lining of your mouth, the tongue, the palate, the teeth, you know, all the way down the throat. Yeah. So that is the oral cavity. And in the oral cavity, you can have cancer. And like we said, there are majorly, you can say, two different types, where we have tumors and malignancy. The tumors are what we call benign lesions. Benign meaning wherever the proliferation is happening, let's say if it's on your tongue, that tumor stays there. Mm-hmm. So it just grows bigger and bigger and bigger. If it's on your jaw, you find your jaw is becoming bigger and bigger and bigger, but it is not moving from that side. So that is what we call a benign lesion, meaning it's not moving from that particular place. But we also have now what we call oral cancer proper, or malignancy. This is where abnormal proliferation of the cell starts at a particular point, and then there is a chance of it moving either through the lymph nodes or blood to other areas. Okay. So that's basically how you can categorize the different types of oral tumors. Mm-hmm. Yes.
Any ways of one avoiding the same?
Yes. Mm-hmm. I think that, like any other cancer, the most important point is, you know, early diagnosis. And how do we, you know this kind of things? You know, most of the oral cancer, they start as a small, you know, ulcer in the mouth, okay? So you find you have an oral ulcer, which is not healing. Mm-hmm. Most of the time you find within 2 weeks, if you have an oral lesion in the mouth, within 2 weeks it has already healed. Mm-hmm. But in a case where you find you are having that lesion, prolonged, you know, it stays for a very long time without it healing, then it is important that you visit the dentist. Okay. Other signs are, you know, you find some abnormal discoloration in your mouth. Most of them appear as reddish. Sometimes they can appear as a white discoloration. Most of them are usually flat when they are starting, but as time goes by, you find it's getting like an ulceration where you start feeling some pain. So that's one of the things that you can check out for. The other thing is where you find there is abnormal growth, let's say of your jaw. It's becoming bigger. Okay. Other things that we find commonly is you find your tongue, which used to move around the mouth comfortably, you find it's now getting fixated. Okay. Meaning it's not able to move as it used to move before. Some other people present with swellings inside the mouth. So you can find on the palate you are getting something which is progressively becoming bigger. Okay. There are people who would get pain during swallowing. So you find you used to swallow food normally, and recently you find every time you swallow you're feeling pain. So those are signs and symptoms of cancer. It doesn't mean that there is cancer, but it just prompts you to know that you need to visit a dentist who's going to have a look and will be able to advise you accordingly. All right. Well, another question is on the plastic teeth, which is very common. One care. Yes. How do you get to know that you got the right one? Yes. And even for the old ones or the oldies, is this recommended for the young ones also? And what would inform such? Yeah. I think when your viewer asked that question about plastic teeth, they meant, if I'm not wrong, because it's a question that I get most of the time. Okay. They meant, when babies are born, some of them, the mothers, yes, the plastic, mama, yes, so I thought, yes, it happens a lot, and it is very common. I can tell you. I used to hear my mom say that, mtoto amezaliwa meno hizo fake zimekuja, so you have to like sugua they disappear. Yes. All right. Actually, that's a very brilliant question, and and that's why we spoke of demystifying dentistry, because there's a lot of myths around plastic teeth. So what are plastic teeth? Plastic teeth is just, you can categorize them into two. So they are there? They are there. Okay. But plastic teeth is more of a layman language of explaining what is happening. So we can have, these are basically teeth that babies are born with or come to the mouth within the first at a very early stage. Yeah. So in the right language, we call them neonatal teeth. Okay. So we can have neonatal teeth or natal teeth. So when it is natal teeth, it means when the baby is born, they are born with that tooth. Okay. And neonatal tooth means it's teeth that come within the first 1 month or 2 months after the child is born. So the child is not born with it, but it comes later. So those are neonatal teeth, and natal teeth are the ones that the child is born with. Okay. So now, what causes this? They are caused by, where the tooth bud, because teeth grow like a seed. Okay. The way you plant a seed and then it sprouts out. So there is what we call a tooth bud. It is found inside the gum pads, So if these teeth buds are so superficially placed, sometimes you find they erupt earlier. Okay. So when they erupt earlier, that's when either the child is born with the tooth or the tooth comes earlier than normal. Okay. Now, the misconception that people have is that, or what they think is that this neonatal and natal teeth or plastic teeth all of them are abnormal and they need to be removed. It is not true. So these plastic teeth, when you find that you have them, what you're supposed to do, even if it is in a hospital setup, they are supposed to call a dentist or a dental surgeon to come and review the baby. The first thing that we normally check is the mobility of the tooth. There are some of them that the baby is born with, and they are very, very mobile. So that is a danger because the baby can aspirate the teeth as they are suckling. Okay. So for those ones, we have to remove them. Okay. But then again, you don't just remove them anyhowly, because when the baby is just born, the clotting factors and all other things, vitamin K, you have to put into consideration of that, because there is risk of bleeding, a lot of bleeding. So the dentist will be able to check and ascertain whether that tooth needs to be removed. There are others that are there and they are firm. So those then, if they are very firm, those are normal. You just leave them like that, and
over time they will.
They'll not come out actually. Most of them, they are just the normal teeth. That it's only that the tooth bud was very superficially placed.
So there's nothing that you do in the process, in this process. You just allow them to.
Yeah, if they are firm and they are okay, you allow them to grow. But the other consideration that we normally put is because this baby is breastfeeding, so there are times when the mother will come and start complaining that the baby is really biting on the nipple, and it's a syndrome we call Riga-Fede syndrome, where the baby, as they are feeding, they are really, causing a lot of injury to the nipple. So those are some of the things that we also have to put into consideration on the kind of management that you are going to do. But then there are also other patients who come and they tell you they have plastic teeth, and you check, there is nothing. So what is happening is, the gum pad of a baby is very thin and very transparent. And sometimes if you check, you might find there are small bumps. Those are normal. They just look whitish because the layer covering them is very, very thin. So it's not a tooth which is there. So the most important thing is, before any action is taken, a qualified dental surgeon has to check
to be consulted,
and then know what to do. And before we move from that, there is what we call oral mutilation. This is where in some cultures in Kenya, they believe that those plastic teeth have to be removed. So you find they take, it's very prevalent, especially among the Kamba and the
Western region.
Yes, Western region. So where they take the children to their grandparents, grandmothers, to have them removed. And you know what they do? They do that with a hot spoon. You can imagine, and they yank out the tooth pads and
hold it right there.
It is. That's why we call it oral mutilation, because it's very painful.
But it works.
No, it doesn't.
All right. Why do you say it doesn't work? We get to learn that after a break. Let's learn that after this short break. Let's learn that after this short break. Yeah. Welcome back. We are still on Demystifying Dentistry, and with me is dental surgeon from Riverside Dental Suite, Dr. PJ Muriuki, who's taking us through that. Before we went for that break, we were trying to just understand some of the difficulties that mummies go through, or parents go through, or guardians go through, especially at a very tender age. I mean, when they have kids who are way tender, just been born maybe months later, and they start developing these plastic teeth, what is, commonly known as plastic teeth. And so we just want to understand how best you can deal with the same. And so, in my own experience, I've constantly had, my mom speak of sugua hiyo kitu ipoteleni, meno fake and all that. But the Terry here says it is not right. So back to you. Why do you argue it is not right?
Like I said, some of these teeth that people call plastic are just normal teeth. So in that aspect, you are damaging a normal tooth. Second thing is the mutilation that goes on, for them to remove. I've already told you what they normally use. So there is definitely risk of infection, because you can imagine it's not like they are wearing gloves or sterilizing those things before they use them. So the risk of infection, and this baby, below 6 months, they have what we call innate immunity. Basically, they rely on the breast milk for their immunity. So any infection would be catastrophic for them. That, we already talked about the bleeding.
Yes.
When babies are at a very early stage, and that's why when they are born, they are injected with vitamin K and all those things, the clotting issue. So you might yank out those things and they bleed, even to death. And off air, I was just telling you, my first case that I saw was when I was doing my internship in Kenyatta. A baby was brought, they had been taken to Kangundo, to a very famous old lady who does that, and they bled. And by the time the baby was coming to us, she was paper white. Meaning they had lost all the blood, and unfortunately we lost the baby. So it's a practice which should be really discouraged. It's more like FGM, but now this time in the oral cavity. So it's very dangerous and should be really avoided. And if you have any concern, you just need to visit a qualified healthcare personnel in the public hospitals. They should be able to advise, because funny thing, some of these myths are also propagated by people out there who call themselves doctors, and mostly quacks. So it is important for people to get information in the right places.
Okay. Yes. With this plastic teeth, or if a baby develops them pretty much early and it is dealt with, does it in any way alter the timelines, of course, in terms of growth of these other, teeth that will be considered good?
Not really. In fact, it has no implications in terms of, the future development of the other teeth. But yes, it does if it is removed and it was there was no need for it to be removed. So that can definitely affect the other oncoming teeth. And sometimes in oral mutilation, the way they remove them, they even remove even the permanent tooth bud. So you find when now you grow up, there is a missing tooth, because they removed even the tooth bud for the permanent teeth. Remember, whatever is coming out is the milk tooth.
Yes.
So there is a tooth bud underneath it for the permanent tooth. So if it is also removed, it means you will have some teeth missing in the future. Yes.
On several occasions I've had, mommies speak of the scenario, where, the teeth of their children has been probably spoiled by medicine.
Yes.
I mean, taking a lot of medicine. Is that really true? Does it happen?
Yes.
Okay.
Yes. There are, it's a very common thing. There are some medication that you can take when you are expectant, and they actually affect, the development of the teeth.
Okay.
And also there are medication that the baby themselves can take and affect their teeth. So one example is a medication called tetracycline. So if you take tetracycline, it's an antibiotic. If you take it when you're pregnant, then that definitely will have an implication on the teeth of the baby. It is not more of them becoming decayed, it is them getting discolored. So they look grayish in color. Okay. So that it's called tetracycline staining. The teeth become discolored because of that. But also there is now when the child is born and they have a lot of, probably a health condition, and they have to take a lot of medication. Most of this medication they take are syrups, and they are sweetened, for them to be palatable for the kids to take. So you find that because of that sugar, it can definitely cause the teeth to decay. And also, another thing still related to that is the breast milk. The breast milk also has a lot of, lactose, which is a type of a sugar. And when the baby develops teeth, this lactose can really affect those teeth. And this is why I tell parents that the right time to brush your kid is the moment you see the first tooth in that mouth. Okay? So if you don't brush, not really brushing, you can wipe. Just take a cotton or a cotton cloth, and after they finish breastfeeding, just wipe it out.
With a paste?
No, just plain water.
Okay.
Just plain
but
water.
Nowadays you have paste for babies, that's okay?
Yeah, but I'm talking of babies who are like very young. Yeah, they can't even spit if you use
toothpaste. Yeah.
So just a clean cloth soaked in water, just rub the teeth immediately after they breastfeed, and especially at night. Because what happens is when they are, breastfeeding and then they sleep with some milk left in the mouth. And that's sugar. Plus the bacteria in the mouth, that really damages the teeth. So it's important you wipe them out. And that is also one of the things that cause what we call early childhood caries, where you see a baby has black teeth, brown teeth, all of them destroyed. It's caused by breastfeeding and without wiping, or a baby sleeping with a bottle. There are those who nurse at night.
Yes, at night.
Yes, so that milk really destroys the teeth, and it happens to children who are less than 3 years.
Oh.
Yes.
All right. Now that I had confused this with, I don't know whether it is also the right word to use, you will tell me or correct me if I'm wrong, artificial teeth, yeah? Because when this viewer asked of plastic, I almost assumed that, yes, we're talking about the artificial teeth. So let's get to that.
Yes.
In terms of, care, in terms of what would warrant for someone to get artificial teeth. And when we talk about teeth replacement, are we talking about getting artificial teeth or someone getting artificial teeth, or what exactly are we talking about?
Good. So that's a very good question, and again, very, very broad in terms of explanations. So, of course, now we are talking about teeth replacement. This is where you've lost a tooth or all teeth, and you need to have them replaced. So, of course, depending with the number of teeth that you've lost, there can be partial replacement. Yeah. Okay. Where we are replacing a few missing teeth, and then we have complete replacement of those teeth. That's where you have a person who doesn't have any tooth remaining in the mouth. So broadly speaking, there can be two types. We can have permanent replacement or fixed replacement. That means it's those ones that you can't remove yourself. So we are talking of things like implants, okay? We are talking of things like crown and bridge. So those are fixed. They are fixed such that you cannot be able to remove. Okay. Then we have the removable ones. The removable ones are what we commonly refer to as dentures, okay? Yes. So they can be partial, meaning you are just replacing the missing teeth, a few missing teeth, and complete. Complete now is where we see this old elderly parents and grandparents who have absolutely no tooth. And of course, now for them, we have to put a full set of teeth. Okay. So both up and for the lower jaw, so that they are able to feed. Yes. All right. So cleaning and all that sometimes there's a lot of questions that revolve around that. And it's easier with those ones that are removable dentures, because then you're able to clean as you see. Yes. But these ones that are fixed permanently, how easy is it to clean them? And when we speak about cleaning them, do they function as the normal teeth would? Yeah. But of course, we always say, for us as dentists, what we try to do is imitate what God gave you. Okay. And we always say, if you can save your tooth, that is the best, because whatever else you get cannot match your natural tooth. Oh, okay. Okay. So, but yes, they do work very well, but of course there is a learning curve. So it doesn't mean that if you are, given today, you'll be able to function as normal. So there is a learning curve, but now once you get used to it, it should be okay. In terms of cleaning, of course, the removable ones are easier to clean because, of course, you remove and clean. The fixed one, we have special brushes that you are able to use for cleaning. And once you do that, then there shouldn't be a problem. So we have special flosses. There is one that we call a water floss. So it's a jet of water that goes in between the prostheses, to clean them up. And also the normal cleaning with a brush should help at least cleaning on the outer surface. Okay. But in between, you have to use a special floss to clean them. If you don't, then they start smelling, and you'll have bad breath. Yes. For the artificial ones, or for the removable ones, after how long should one replace them? If it is dentures, we normally say around 4 years, 4 to 5 years. But then again, it depends with the patient. There are patients who even stay with them for 10 years and they're still okay. The reason for that is because if it's a complete denture, like the case that we did the other time, in fact, that lady that I helped, now we are replacing. Okay. Because this is, I think, 6 years now. All right. No, around 5 years now. So you replace because the bone also shrinks. Because remember, they are sitting on the bone. So there is resorption, the normal resorption of the bone. So with time, they become loose. Okay. So you need to have them replaced. Now, for the permanent ones, it's basically meant to be permanent. But as you know, there is nothing permanent. So again, it's patient specific. Okay. There are patients who will, do a very good job in terms of maintaining, cleaning them, and always going for yearly checkups. For those ones, they can even sub them over 10 years, you know, going forwards. I've seen some that are even 30 years old because the patient is very clean.
Yeah.
So as much as the dentist can do a very good job, the patient also has a role in maintaining them, and that will determine how long, you know,
she can keep it.
Yes.
Okay. One will get us back to the babies briefly. I know this in a way we could have answered, but I'll ask it all the same because it's been sent by a viewer, and maybe couple it with another question. He asks why young children below 3 years have teeth decay.
Yes.
Or tooth decay.
Yeah.
I think in a way you've touched on that while we're discussing the medicine, but if there's anything more to add, then you can. And I also want to couple this with this question. To what age then should we say that babies should start, I don't know, losing, is it losing? What is the best word to use when we say menu inangoka? I mean, amakutingika. And there's a scenario where I've been told sometimes for others, you know, it gets to that stage, but they really do not get the shake. So sometimes if as a parent you're not keen, you realize that another teeth or another tooth will start, you know, popping out, and in this case then it means they struggle.
Yes. Good. So just like we said, for babies there is what we call, like below 3 years, it's called early childhood caries, meaning it's the teeth that are decaying, you know, for young children at that age. The most common cause, in fact, that name is also, it has an alias, aka it's called baby bottle disease. Okay. Okay, so you can figure out, you know, it's mostly caused by that milk. So you find there are babies who can't sleep if the breast is not in the mouth or a baby bottle. So what happens is now when they sleep, the milk is left covering the teeth. And we say that milk has a lot of sugars, you know. So plus now the bacteria in the mouth, it forms an acid which now starts, you know, destroying the teeth. And most of the time you'll find the teeth that are affected are the top ones. Because for the bottom ones, there is the tongue which keeps wiping them. So the tongue keeps wiping them, and there is a lot of saliva there. But for the top teeth, you find that's where most of the damage happens. So how to avoid it is the moment you see a tooth in the mouth, especially when you're breastfeeding, make sure that you get a clean piece of cloth and be wiping those teeth, especially when you're putting the baby to sleep. Once you do that, you should be okay.
What about the tongue? Because sometimes you find that kids develop this whitish substance, and I mean, for others it's extremely, you know, chronic.
So for, you know, if it's young kids, you know, that can't brush, again, you can just wipe and make sure they are well hydrated. Like after breastfeeding, they can take water, which should be able to wipe that down. For the others who are at least older, you can brush their tongue. You know, that will help a lot. Yes.
All right.
And about the shaking of the teeth, yes, the actually milk teeth, and this is another misconception that parents have. You know, meno yake iko na shimo atoa tu. Those teeth have functions. God did not just give us those teeth for. They have a function of number one, maintaining space for the permanent teeth. So it's like the way you can tell someone you're going to the movies, you tell them, hey, nishikie kiti. You know? So these teeth are preserving those spaces for the permanent teeth. So what happens is if you lose that tooth before the scheduled time, that space collapses. So when that space collapses, when now the time for that tooth, because every other tooth has a specific time when it's supposed to grow. So if you lose that milk tooth, which was preserving that space earlier, that space collapses. When it collapses and the other tooth is now supposed to come, there's no space, and it starts growing combo. And that's when people say, I have a home. You know, there's a tooth which is growing on top of another one. It's because you lost, you know, the tooth that was supposed to maintain that space. The other function of those teeth is nutrition. Because without teeth, you are not able to feed properly. So they are really important, and you have to maintain them. Only to be removed when they start shaking. Now, each of those teeth, most babies start shedding off the milk teeth at around 5 to 6 years. There are others, especially girls, who do that earlier. But for boys, most of the time they have what we call delayed exfoliation or delayed eruption. So you find the teeth are not shaking, or it's shaking kidogo and then becomes firm. Shakes kidogo and becomes firm. So in that scenario, what you're supposed to do, if it's within that range, you're just supposed to go and visit a dentist. They'll check and see whether it is you know, the reason for it not to shake. Most of the time you find it's because the permanent tooth, which is coming down there, and the milk tooth, which is in the mouth, the roots are not aligned.
Okay.
Because what happens is, as this other one is coming up, it eats away the roots of the milk tooth. And that's how it starts shaking, because it's pushing it out.
Up, yeah.
But now if they are not properly aligned and the teeth are, you know, this is the milk tooth, this is the permanent tooth, then it's going to erupt below or behind the other one.
Okay.
And you find that you have the milk teeth here and the permanent teeth behind them. So you need to have them removed professionally.
Okay,
Yes.
okay. Well, that's a good one. I hope you have learned something. Let's talk about filling and root canals.
Yes.
This one is very common.
Yes.
People get confused in between.
Yeah.
But then again, people die for that.
Yes.
Because then you want to literally ziba that. And I mean, in this one, you'll allow us to do a lot of Swahili, so at least it's 6. So well, that's the reason why you said home and all that. So at least people can get to understand.
Yes.
So what is the difference between these ones?
Root canal and filling are just a way of managing, you know, a person who has teeth that have cavities. Now, cavities ni mashimo, the ones that are usually in the mouth. So this, before we understand how cavities come about, a tooth as it is, I wish I came with my models, I would demonstrate, but a tooth basically has 3 layers. So the first layer is what we see when you smile. It's called the enamel, the white layer. Then beneath it, it's around 2 to 3 millimeters. Beneath it, we have another layer called dentin. Then at the center of the tooth, there is what we call the pulp or the nerves, where the nerves and the blood vessels are. So the outer layer of the tooth, the enamel, what we see, is usually, in quotes, dead. So it can't feel any pain. Okay? The middle layer, what we call dentin, is, again, in quotes, semi-living.
Okay.
It can feel sensations. Hot, cold, it can feel. Then the inner layer of the tooth, what we say is the living part of the tooth, is where you have the blood vessels, the nerves, you know, and those arteries and veins and everything. So that's the living part, or the engine of the tooth. So now, when you develop a cavity, of course, because it's developing from the mouth, the first layer to be attacked is the enamel, the outer layer that we see.
Okay.
So when the cavity is starting, you actually can't tell. You can't feel anything.
Okay.
Probably you can see it, but there's no pain. So you say, I knew me, you know, so you just ignore it. These cavities are usually progressive. Actually, the right word is dental caries, or dental decay. Okay. So it's a progressive disease.
So dental decay is now the brown color?
It's actually the formation, the process of formation of a cavity. Of a cavity. Yes. Yeah. So the decay now is a disease. Okay. So when the cavity now starts, because it's actually an infection, it's a bacterial infection on the tooth. So it starts on the outer layer. We said it's dead, so you don't feel anything. You just see some discoloration, black, brown. Then it's a progressive disease. So it goes to the middle layer. Okay. So when it gets to the middle layer, we say the middle layer is semi-living. So that's when you start feeling sensitivity. So you take your cup of cold water or, you know, hot tea, and you feel there is something. Not really pain, but you feel, there is something that is happening there. So that means that cavity is in the dentin. Yeah. If you don't have it attended, then it progressively gets now to the center of the tooth. And there is a picture there which is showing, as you can see, the outer layer, then there is the middle layer, and then the inner layer. Yes. So now when the disease is on the outer 2 layers, that's the enamel and the dentin, that is when you can do a filling. Okay. Because it means the infection is on those 2 layers, and it has not gotten to the center. Okay. Now when you do at that particular time, the diagram is showing us, it's cheaper because it's just a filling that you're doing, you know. But the more you stay without having it sorted out, like we said, it's a progressive disease, it gets now to the nerve. So
the filling protects us from getting down, but then you have to constantly do that.
Yes, so the filling, what we normally do is now, we remove the decayed part. See, more like what they do in a pothole. Okay. So they come and remove the pothole and then fill it up. So that's the same thing that we do, but now, of course, with a different material. So we prepare and remove the decayed part, and replace it with a filling. Okay, so that's now what we call a filling, but the right word for it is restoration.
Okay.
Okay. Now it's cheaper because you know, it's still in the early stages, and the outcome is more predictable.
Okay.
Now, when you neglect and you don't go to the dentist because you're not feeling pain, now when pain comes, it means the infection has gotten to the center of the tooth. Okay, where we have the nerves, the blood vessels, and all those other things.
Right.
So that's now when all hell breaks loose.
Right.
You can't sleep, you can't function. That is now what we call a toothache. And it is really, really painful. I don't know whether you've ever had a toothache.
You know,
yourself.
I have never had that, but I keep saying this story.
Yes.
That I have literally seen my dad cry.
Yes.
And you know, that is so strange, yeah? Literally seen him shed tears.
Yes.
And then every other time you speak about tooth decay and all that, I know, I can almost relate.
Yes. So now when it gets to the nerve, that's now when you do a root canal. Okay? So the nerves are found in small tubules called canals. Okay? So what we normally do is we clean out the decay, but we go all the way to the nerves, because it means the infection has gotten to the nerves, and the nerves are going all the way down to the roots. So you get inside there, of course with specialized machines, and remove the nerves. You're not removing the tooth, it's the nerves. So you disconnect that tooth from the nerve supply.
Okay.
You clean it out nicely, and then now you do a root filling. And finally, where there was decay on the tooth, you do a filling.
Okay.
So that's the difference between a root canal and a filling. And the misconception or the myth is that it's either or. You choose what you want. No. It's actually, it is not your choice. It is actually dependent on the stage of progression of the dental decay.
Okay.
So where it is determines what is going to be done. So it's not an either or kind of situation.
Okay.
Yes.
All right. We still have very many questions here. For a moment, I want to ask much about braces and at what point you decide that you would want to get braces and all that.
Yeah.
But then time is not on our side. So it is my request that you have time for us some other time, because, well, I'd easily say, let's connect you to the people who've asked all these questions. But then I'm thinking all these questions are equally important to everyone, you know, to get to learn and to know all that. So, you know, I'll sweet talk my producer, so at least we can have you some other time to expound on this, on braces, you know, safe treatment. We can talk about, you know, fluorosis, which is brown teeth. We'd love to understand some more, because there are people who have them and they have no pain in anything, and you know, they stay that way for the rest of time. So we need to understand all this and what would cause that and how you'd get to avoid them. So please allow us to do this some other time.
That's okay.
Thank you so much, Dr. PJ Muriuki, dental surgeon, Riverside Dental Sit. And we're all discussing or talking about demystifying dentistry. So much still yet to be covered, but worry not, because I got you covered right here in Morning Cafe. We'll make sure that we get more time for that, and we'll make sure that you're updated that Dr. will be coming when he will be coming, so that you do not miss out on that particular episode. Otherwise, it was good having you from morning up until now. I have to say kwaheri, as I look forward to seeing you again tomorrow. My name is Linda Alela. The program is Morning Cafe. See you tomorrow. Bye-bye.